Hello, it's Dr. Rhonda Johnson. Today I'm talking about blood donation. It's Sunday, January 7th, 2024. In January, if you didn't know this, is designated as National Blood Donor Month in the United States. Now, why am I talking about blood donation? Because if you ever have needed a blood transfusion, you know that it is a life-saving medical intervention. So why give blood? Well, blood donors generally give blood to help others who need it. Now, how long does it take? Well, this health screening part can take anywhere between 30 to 45 minutes, depending on the site. But once you're donating, it generally only takes 45 minutes to an hour, depending on how much blood you're donating. Now, what is donated blood used for? Well, 1 unit of blood can be separated into 4 individual blood components that can help save multiple lives. The red blood cells can be used to treat patients who have lost blood due to trauma or surgery. Plasma, the liquid part of the blood, is typically given to patients who require treatment to improve blood clotting. Platelets are the third component. They clot the blood. And they're often used in the treatment of patients with cancer or those who are undergoing organ transplants. And then lastly, you can have cryoprecipitated anti-hemophiliac factor, AHF, which is derived from donated blood and used for clotting factors. Now, I want to speak to this issue of COVID vaccination and blood donation. The Food and Drug Administration has said that there is no need to distinguish between blood that's donated from vaccinated individuals versus blood donated from unvaccinated individuals. So that's not a question that's asked in the screening. So therefore, the blood won't be labeled with that information, and hospitals are not able to tell you whether or not a unit of blood was donated by a vaccinated individual. But there are other vaccines that can cause deferment of blood donation. So, for example, there are waiting periods between 2 to 4 weeks before donating blood if you've had live attenuated viral or bacterial vaccines, such as the measles, mumps, and rubella, or the oral typhoid vaccine, or yellow fever, or shingles or chickenpox vaccines, to just name a few. Now, there are some other common reasons why people may not be eligible to donate blood. Number one is if you're sick. Even if you have the cold or the flu, wait until you're in good health. There's also exclusions for certain medications and certain conditions. There's exclusion for travel. For example, if you've traveled or lived in a malaria risk country, you may be excluded for anywhere between 3 months to 3 years before you can donate blood. So where can you donate blood? Well, there's blood mobiles. These are mobile blood donation vehicles specially constructed for blood donation. Many institutions in the community will have blood drives. Sometimes you see them at fire and police stations or colleges or churches or high schools or different community organizations. People can also donate blood at community blood centers, freestanding blood donation centers, and sometimes in hospital-based donor centers. If you're not sure where you can donate blood and you want to see if you're eligible, go to the American Red Cross website, and they have a tool that will help you locate a blood donation site in your community. That's my message today. Again, blood donation is very important, and you may just save a life. Take care, folks, and be well.